Okay, we're gonna get together here. Welcome everybody. We're all 900 of us who fit inside the parking lot, first of all, I'm gonna say, which is awesome, right? So welcome everyone. Thanks for joining us. I'm Peter Newcomer. I'm the Chief Operating Officer for UW Health, and just super glad to see everybody here today. And I know we're all excited about this building and about what's going to happen in its walls. So I'm going to be the MC for the ceremony that we have today. It's going to be a brief ceremony. And as you can see, we're here eventually, I don't know if I can see it, we're here to cut a ribbon at the end of this ceremony. We'll all get up and cut that at the end. But this is an impressive medical center. You've seen on our digital wall, you've heard people walking around, you've seen me probably talk about it too much over the last few years, but 480,000 square feet, a drive-through pharmacy, solar array, the biggest one in the state, academic-led clinic for us with clinical trials, support for all of our teams that we teach while we care for patients in this building. Many advanced treatments that we don't really provide anywhere else and certainly aren't provided in most clinics, like theranostics and ultimately proton therapy. As you know, for those of you that have worked on this project over the last many years, Eastpark is more than just an impressive building with all those things in it, more than just the walls around us, but it's all about the people and our approach to care for those people. We're going to lean into what is unique about UW Health, which is being an academic medical system and leading with clinical trials, leading with cutting-edge therapies that you cannot get anywhere else. And then as we lead with that, wrapping our care around our patients here in this facility in a way that we're not able to do elsewhere. The largest healthcare facility in the country this year for a reason. It's got all of those things that we need. We're here to kick off an entirely new and exciting chapter for UW Health for our over 800,000 patients and for the communities throughout Wisconsin and Illinois that we serve. As I look around the audience, I see, and as I walked through the audience earlier, I see many of the clinicians, the staff, and partners that help take this idea and make it into an exciting reality. In particular, I'd like to acknowledge two individuals that have been part of our Eastpark leadership team since its inception. Teresa Neely, our Chief Operating Officer for Ambulatory Care. I don't know where you are, Teresa, but Teresa, instrumental to everything from day one till day plus, 600, right? Getting this thing up and running, getting our clinicians and our patients here, starting in just a couple weeks. And really very close to who I just saw is Liz Douglas, who until her recent retirement was our Vice President for Facilities and Support Services and got this building out of the earth. Liz, thank you. I'd also like to acknowledge our Chief Administrative Officer, Katrina Lambrecht, who played an integral role in managing the thousands of details that got us across the finish line, or almost across the finish line, for Eastpark Medical Center. Katrina, where are you at? She's here somewhere. Katrina, let's hear for Katrina. And then, the individuals have been amazing, but it's like these groups of people that have been getting together over the last 5 years to put this thing together. Most of you weren't able to see it, but I was fortunate enough to see the dozens of physicians, nurses, administrators getting together to plan this space, patient advice coming into that conversation so we can make it as patient-friendly and as staff-friendly as possible. And so thanks to all those teams that have done all the work to get us here. And I'd like to acknowledge our architects, HKS, who many of them are here today. Thanks for coming, team. And Mortensen Cullen, our general contractors. No project of the scope is done without strong partnerships within our community. I know there are many state and local public officials here today who have been advocates for and supporters of the project. Thank you for helping us make Eastpark a reality. So today is about the future of healthcare. But before we go any further, we need to acknowledge our past. In recognition of and to honor the Ho-Chunk land on which this building sits, we would like to invite Ryan Greendeer, the Executive Government Relations Officer of the Ho-Chunk Nation, to share a few words and offer a land acknowledgement. Ryan?
Thanks. So I had a friend of mine who came with me on a trip where I did several different events in a row, and they asked, what is the point of a land acknowledgement? And I said, well, watch and maybe listen a little bit, because it's not just the land. I went up and talked about the history of the Ho-Chunk people and how we were displaced from these places. And history tells the story one way, and probably a good way, but it's a difficult past. These lands had thousands of Ho-Chunk people that lived in various villages across the state of Wisconsin. And early 1800s, all the way up through probably about 1860s, 1870s, we were pushed off and often, at gunpoint. It was a difficult time. A double-digit percentage of our people perished along the way, along these routes. And only a few hundred of us survived and were able to stay back here in the state of Wisconsin. And I looked, and the school, I think 1924, kind of got its roots here in Wisconsin. That was the same year that Indians were conveyed citizenship by Congress. But throughout this time, these treaties were in effect that were made in exchange for all this land, housing, education, and healthcare. Healthcare for us, though, looked a lot different than it did for everybody else. There were a lot of misdeeds by federal policy. Some of those we can feel the effects of today. Today, my tribe experiences a high rate of mortality from cancer, heart disease, things like diabetes, things that are preventable. However, our people are kind of afraid to go to regular providers because of the history of medical care in American Indian communities. How many American Indian providers do we have in the room? Real high, because I'm not seeing a single one. Well, we're hoping to change that. Last year we were working with UW to announce some tuition promise for med school so that we can get some, so we can change the outlook of our communities. And that's the history of land acknowledgement. That's why it's so important that we do acknowledge what's happened on these lands, because that's going to change. I hope the next time we ask that question, there's going to be hands through the entire crowd. So thank you for the land acknowledgement, and thank you all for the work that you do.
Thanks to Ryan, and thanks to the Ho-Chunk Nation for joining us today. We're grateful to have your presence on this exciting occasion. And before we get to our speakers, I want to give a quick reminder that our brief program and ribbon cutting today, after that, you are all invited to join one of our guided tours of Eastpark Medical Center. You can see firsthand how this facility, but more importantly, the people who work in it, will continue to revolutionize patient care and experience. Now I'd like to turn it over to the person whose vision for Eastpark started us down this exciting path, my boss, Dr. Alan Kaplan, UW Health CEO.
Great, thank you, Pete. I heard 900 people came today, or at least had said they were coming today. So thank you all. Whoop. Uh-oh. I've been told by my staff, don't touch anything. Thanks everyone for coming today. So 8 years ago, those passing by this site saw a cornfield, but at UW Health, we envisioned our future. We saw an opportunity to better serve our local communities and patients seeking care from across Wisconsin, Northern Illinois, and beyond. We saw a chance to improve care, enhance care coordination, introduce leading-edge technology, and pursue groundbreaking clinical trials. We aim to elevate our nationally recognized cancer services and to establish an integrated specialty care program for women. At Eastpark, we will bring 40 medical specialties under one roof, allowing patients to consult multiple providers in a single visit. And we added something that is rare in modern medicine, a technology unheard of, parking. The COVID pandemic slowed us down, but never compromised our vision. And in just a few weeks, we will welcome our first patients to Eastpark Medical Center. As Wisconsin's health system, we are keenly aware of our responsibility to lead health care in a system that is often challenged and constantly evolving. We're a trusted partner in core communities. We're a critical partner to regional health systems across the state. We're often the destination for complex care that patients cannot receive anywhere else. Whether you're from Fond du Lac, Milwaukee, Chicago, Northern Illinois, or right here in Madison, world-class care for complex conditions is now remarkably convenient for you, right off the interstate. Today, we are joined by many partners, supporters, and neighbors who have been integral to our success. I want to extend a special thank you to American Family Insurance for their long-standing partnership, not just with our Children's Hospital, but also in their support of this remarkable East Campus within the American Center Business Park. Even the most esteemed institutions need a helping hand when striving to change the world. I'd like to express our gratitude to the generous donors whose support has made advancements like proton therapy a reality. And at UW Health, our mission is to advance health without compromise through service, scholarship, science, and social responsibility. With our partners at UW School of Medicine and Public Health, we are a nationally renowned academic health system operating at the vital intersection of patient care, research, and education. Eastpark Medical Center was designed to embody that mission. It is now my pleasure to welcome someone who personifies this partnership. The Dean of the UW School of Medicine and Public Health and the Chair of the UW Health Board, Dr. Bob Golden.
Well, thank you, Alan. As the chair of the UW Hospital and Clinics Authority Board, I am so pleased to see how the incredible vision of Dr. Kaplan and others is now on the cusp of becoming a reality. I know how much work went into this project from so many people, many of whom are with us today. Thank you. And I'm delighted to be able to join everyone in celebrating this truly grand opening. As the Dean of the School of Medicine and Public Health, I'm particularly excited about how this new facility was designed to enhance the already remarkable work of our academic health system. The partnership between UW Health and the UW School of Medicine and Public Health is probably the single most important element in advancing our shared vision of improving the health of everyone in Wisconsin and beyond. And we planned this Eastpark Medical Center with that partnership in mind. Clinical and translational research, including the many clinical trials happening at UW and UW Health, are literally changing the way we provide care, not just here, but across the globe. These trials have been integrated with the physical and operational design of Eastpark to ensure that we can build upon our deep legacy as national leaders in research and in innovation. You can see how the partnership between the School of Medicine and Public Health and UW Health is reshaping the future of healthcare with therapies like theragnostics and proton treatment and others that we haven't conceptualized yet that will be conceived and developed here at Eastpark. In many instances, such as upright proton therapy, we will be advancing a paradigm shift. And in other instances, like theragnostics, we will be translating discoveries made in the school's basic science research laboratories into new and improved state-of-the-art care for patients at UW Health. As Alan mentioned, Eastpark is going to be the new home for UW Health's adult cancer care, which reminds us of how proud we are to be home to Wisconsin's only National Cancer Institute designated comprehensive cancer center, the UW Health Carbone Cancer Center. Eastpark Medical Center will increase the visibility and accessibility of our world-renowned clinicians for patients throughout Wisconsin, the Midwest, and beyond. So at this point, it's a great pleasure to turn things over to Dr. Lee Wilkie, Senior Medical Director of Clinical Cancer Services at UW Health and the Carbone Cancer Center, who will highlight the remarkable cancer care we'll be providing here in just a few weeks. Lee?
Oh my goodness. Look at all these people. How fabulous. What an amazing team of individuals that have come together to bring this spectacular building to fruition. I see everyone from nurses to techs to physical therapists to leaders that are helping us get into this space and really bring to reality taking care of our patients. You might imagine I've already gone off script. They gave me a little script. I will give you pieces of the puzzle. But I do want to emphasize the enthusiasm we have as a team of individuals taking care of patients with cancer for getting into this building. As mentioned, the UW Health Carbone Cancer Center has been a pioneer in world-class patient care and cutting-edge research for more than 50 years. We are Wisconsin's only comprehensive cancer center. For those of you who don't know, the National Cancer Institute designates certain institutions as a comprehensive center. We are the only one in Wisconsin, and we're ranked in the top 10% of those NCI-designated cancer centers. That's pretty fabulous. We provide cancer prevention, diagnosis, treatment, survivorship for more than 30,000 people every year. That's crazy. Care innovation driven by research at Carbone means we can deliver precision medicine and customized treatments to individual patients to get the best possible outcomes. We have more than 300 clinical trials that we can offer as options to patients who don't have anything else available to them for treatment. And we're the first in the nation to move forward with an upright proton therapy. I believe there's a model of it sitting right back there, utilizing the Leo Care system. I'm now supposed to say there's a demo model at the event. A precise and comfortable way to deliver radiation, and especially for our children getting proton. With the highest level of care coordination, that's what this building is bringing together. Patients are going to be able to see multiple specialists and undergo needed tests and treatments in the building. We have 73 infusion chairs. That's a lot of people getting infusion on a daily basis, which is fabulous. And look at the amazing space that they're going to get to see. Patients will have the choice of a private or a group setting, and their chemotherapy or targeted therapy. It's not all chemotherapy anymore. And then we're going to have a cancer symptom management clinic where patients with cancer having side effects from their treatment can actually come and get treated by specialists who know and understand those side effects. We're going to be able to help patients physically, emotionally, financially. It's really to give them a calm knowing that we're taking care of every part of their care. There will be supportive services that are holistic with specialists in nutrition, occupational therapy, integrative medicine, cardio-oncology, cancer health psychology, and many more. I can't name them all, so if I've forgotten one of them, I apologize. The Friends of Health UW Positive Image Center with wigs. There's actually like a fabulous place to get your hair done and get the wig done. And the CareWare program is now coming back into our space where we can offer specialized services for our patients that are undergoing treatment. Right behind you is the Ann Fluno Cafe with healthy options created in partnership with our patients. Creating this new care experience was collaborative. It took all of you to do this, so thank you. Now I want to thank a few individuals. So Dr. Paul Harari and Dr. Zach Morris are the current and former chairs, reverse that, former and current chairs of the Department of Human Oncology, who were so integral in bringing proton to this center and this state. It is a great addition to our radiation therapy program, and we are so thankful to them for their leadership in that space. And then the person for who this lobby is named, Dr. Howard Bailey, an immense friend and amazing colleague, who is retiring this year after 3 decades as an oncologist and 10 years as director of our Carbone Cancer Center. We are immensely grateful for his leadership and the generous donors who made this naming possible. So thank you to all of you, and thanks to Howard. Now, in closing, I just want to highlight the remarkable teams that are going to work here. I know I'm going to forget some. Nurses, navigators, physicians, advanced practice providers, schedulers, medical assistants, therapists, social workers, radiology technicians. I'm sorry, I'm out of breath. So thank you very much, and we're really excited to be here. Oh, and now I get to introduce the amazing and distinguished Dr. Ellen Hartenbach. She is the chair of the Department of Obstetrics and Gynecology, and we are thrilled to hear about women's integrative health.
Thank you, Dr. Wilkie. That was just fabulous to go over all the exciting things in cancer. As a GYN oncologist, I'm super excited for this new era in cancer care. And as chair of obstetrics and gynecology, I am equally excited to announce a new era in women's health care. That is integrated specialty care for women. Integrated specialty care for women is not just a distinctive program at Eastpark Medical Center. It is the only program of its kind in Wisconsin and one of just a few in the country. This is the kind of innovative program that we come to learn and love at UW Health. It's built upon the expertise of brilliant clinical researchers and a remarkable healthcare team. I'm really proud to say that the UW Health OBGYN department is ranked number 7 in the nation by US World News Report. Yes, yes. Big applause for the faculty and all the providers in my department. I'm so proud of them. Eastpark has enabled us to bring multiple specialties together in a unique and a highly coordinated way, managing cases from the most common to the most complex female pelvic conditions. Eastpark will be home to both highly innovative non-surgical management strategies and minimally invasive surgical techniques. And in most cases, patients will be able to see multiple providers on the same day at the same location. Conditions such as urinary incontinence or sexual health concerns are life-limiting. While not life-threatening, they're embarrassing to talk about and can have a devastating impact on individuals and families. And for far too long, women have assumed these conditions are just something they need to live with. Integrative specialty care for women is changing the healthcare narrative for women. We're giving women throughout the region hope by fostering an empathic care setting where patients really feel comfortable and encouraged to share their experiences openly and pursue the care that they really need. We're educating them about options that they might not have even known that they have, and providing options that other healthcare systems just simply can't offer. The level of care available at Eastpark is the product of collaboration across multiple specialties, across multiple years to pull it all together. We have specialists in urogynecology and reconstructive pelvic surgery, urologists, gastroenterologists, colorectal surgeons, physical therapists, and even sexual health therapists. So now I'd like to recognize the faculty whose expertise and leadership really helped launch integrative specialty care for women. Dr. Christine Heisler is the director of the Division of Urogynecology and Reconstructive Pelvic Surgery in the Department of OBGYN, and she's the director of the Urogynecology Fellowship Training Program. Dr. Sarah McCachran in the Department of Urology specializes in urogynecology and reconstructive surgery, and she's the dyad lead for outpatient urology. And finally, Madeline Esposito, a certified sex therapist, is the program manager of the UW Health Sexual Health Clinic. And I just really want to thank these clinical leaders. I want to thank all the faculty, I want to thank all the providers, and I want to thank the administrators that really helped us envision this program and bring it to reality, and will continue to make Eastpark the best place to receive care. So, quick round of applause for all of you and for everybody that brought this program together. It's so wonderful to see so many people here to celebrate this new building. I'm going to turn it back over to Dr. Newcomer.
Thank you, Dr. Hartenbach. Inspiring, huh? I mean, you know, sometimes I come to these things and I think, oh, that might be boring, you know, we're doing this introductory. This is inspiring stuff, right? This is cool. This is why we're here in this building, because we have these type of leaders in this organization. So, really awesome. I need to get some detailed stuff out next, which includes, everybody had their own words, so I can't find it. Hang on. Last page, Pete. Okay, it's about the tours. So I'd like to ask Dr. Kaplan and everybody on the stage here to join me and a few others as we cut this big ribbon here in a minute, and as we open this remarkable new medical center for our patients and the future of patient care in Wisconsin. And so let's get this thing fixed. Where are we going for that ribbon, guys? All right. So after the ribbon cutting, I'll just tell you this while we're getting that up. We're going to begin offering guided tours in just a few minutes. We're going to start from both sides, from the north wing and the south wing. And for those of you that want to see the facility, we need you to stick with your group. So really, there's parts of this that aren't completely done yet. I mean, you might have heard the squeaking in the door over there. We got some WD-40. We need to get on that. And that's true in other parts of this building as well. So stick with the tour. Don't go rogue on us. The tours will leave from the north end of the lobby right here, just past the cafe behind me, and from the south end of the lobby toward the welcome desk and parking ramp. And everybody's going to make the same tour stops. Don't worry, you're not going to get in one group better than the other, just a different order. And we have volunteers helping to organize those groups, about 25 people per group, and they're leaving every 6 or 7 minutes. So if you didn't get in the first one, just hang around and get in the next one. And we hope we can accommodate everybody. But given the size of this crowd, if some of you or staff who will be working in the building, please consider giving other guests the opportunity to hop in for one of the earlier tours. And continue to enjoy the refreshments and one another's company in the meantime. So ribbon cutting next, but thanks all for being here. And here we go.